Hello, hello, hello. This is Tooth Be Told, Dr. Kyle Dumpert.
Dr. Walter Aka.
And Dr. Sherwa Hassan.
Yes. This has been a 2 years in the making. I asked Dr. Hassan to come on about 2 years ago because he was transitioning from being a general dentist to going into endo residency.
Yeah.
So I said, hey, you gotta come and tell the listeners like what made you transition this way, right? Because for me, it was a lot of factors, and mostly to deal with corporate dentistry and me hating dentures. So that was an easy story for me, But like when he told me the whole story, it was very interesting. So I said, you gotta come on. But he wanted to kind of go through the whole experience so that he had a full story to tell.
Absolutely.
Yeah.
So
I'm
that's
excited to
why.
hear this. Last time I talked to Sherwa, it was before he started endo residency, and he reached out to me about possibly moving to Hawaii for a little bit. I don't think that ever happened, but I'm very
It's
excited to
close.
hear.
It's close.
So that's where we're at, right? There's a lot of
Yeah.
there's a lot of moving parts. So Dr. Hassan, please start from the beginning. Let
All
us
right.
know what your process was when you were a general dentist and what made you transition to endo and endo residency and so forth. And we'll just ask questions as we go along.
I got you. Before I talk about myself, first I got to give credit and props to what credit is due. What you guys have done with this podcast and this platform is phenomenal. I've been a secret admirer since day one. As a matter of fact, Tooth Be Told was one of my jokes in dental school. Man, it, it was an oral surgery residency. I'm like, you know what? Tooth Be Told, and then I got a couple laughs, and it's been good since then. So I wanted to let you know I never copyrighted it. You know, so
Right, right.
good.
Maybe you should
But
have.
I appreciate you. Sometimes you just got to give in life. You just got to
My
give.
man, my man.
People don't know Kyle and I were classmates.
Yep.
We were actual classmates. We were friends. We were buddies, and this clean cut Bedford stud. He's a wild boy, man. They don't know, but he's a wild boy. That's all I'm gonna say. I am not gonna air out some information, but just say if you ever need backup, Cal's the man to actually reach out to.
That's
Okay.
that's
Yeah,
another episode.
absolutely. He knows what I'm talking about. And Walter is the guy. He's that guy.
Oh,
Walter
you're
is the
ridiculous.
guy that in dental school he was like the big bro. You know what I mean? Any questions that you had, like I came in as Walter left.
Yeah.
All right. So I came in as Walter left. He just finished his GPR. Even while he was in his GPR, he came back to the school and gave like a whole class a presentation about being in GPR. So he's always been that kind of guy that's always been willing to help out no matter what. And that's just from dental school.
Right.
After dental school, Walter was one of those, yeah, I'll probably say, not the guy, one of the main influences I had. I would always call him up. Um, I would have a random surgery, and I don't know, something goes wrong. I go, oh snap! I'll be right back. I leave the operatory. Yo, what? give me some advice, man. She can't stop bleeding, bro. Yeah, I mean, he's been an asset from day one in clinic, outside of clinic. So I appreciate you, and
Not
even in terms of me actually pursuing my residency. So I before I actually made this decision to go back, I called Walt up, and he was amongst Walter and my man Gary Dennis. Shout out Gary Dennis,
yes.
the OG from Houston,
Yep.
Houston's finest. I think he's also from DC, like you, right? Yeah.
Yep. No, he's from
Yeah.
DC. Sure. Yep.
There we go. Yeah. So that
Yeah.
you two guys have been instrumental in my transition into specialty, and that was. I just have to get that off my chest. Thank you. I appreciate you,
No,
Gary. If you're listening, I appreciate you too, brother. That being said, when I was in dental school, I had an inclination for endo. So during my third year, I spent a lot of time in the endo clinic, and in the fourth year, I spent a lot of time in my endo clinic, and I started getting a senioritis a little bit, and spoke with the director and some of the faculty members, and they said, "Listen, uh, getting experience before you go into endo is very, very helpful." And I was like, you know what? That's not a bad idea. Let me get a year or two underneath my belt, and then come back and apply again. Right. So that was my that was my plan, right?
Mhm.
Plans, of course, you have plans, and plans change. So I got out of school. You know how it is when you're a dental student. You are a professional broke artist, right? So you got 4 years of undergrad that prepped you, and then you have another 4 years of dental school, and fast as your best friend, and you're out there just living your best life on 21K a year. And that hasn't changed, by the way. It's still going on till this day. Right? Inflation be darned. They're still giving people 21K a year.
Right.
But I'll talk about that later on. So once you start working in private practice, you get comfortable. I got comfortable.
Mhm.
I mean, I still always had the inclination. I said, hey, as soon as you get a year or two underneath your belt, just apply again. Nothing was guaranteed, but at least apply. Um, you did make some connections while you were at Pitt Dental, and just kind of maintain those relationships and see where it takes you.
So why
I
a year or two? Like, what made you say, okay, I want to do this for a year or two before I apply into? Because a lot of people want to go straight from dental school to residency, right? To
So
specialty.
yes. So endo is one of those specialties whereby they really value experience.
Okay.
Like it's actually, if you look at most programs, it's very rare to see somebody fresh out of dental school
Okay.
to just go right in. So they would tell you at the very least get a year or two, whether it be GPR or just private practice, at least, right? It's like a bare minimum. If you try to come fresh out of school, they would just say, "Listen, we like you. Just get a little experience," because it's very endo is a specialty that it's still dentistry, right? So let's say you do perio or surgery, it's surgery. If you're doing ortho, it's ortho, right? Endo is still general dentistry. It's just a little more narrow, right? You're still using the handpiece for everything that you do. You still have to have a fundamental understanding of restorative procedures. So it's and you still have to know how to deal with patients from a treatment planning perspective. So having that background, and I think it's more so knowing just how to be with patients, right? In
Right.
dental school, I mean, we don't see that many people in general in terms of as patients. And when you come out, you're still learning how to just present yourself, how to be a doctor, be a dentist, be a clinician, right?
Hmm.
So that 1 2 years, you kind of you get that mojo going, and you're not as rusty when it comes to speaking with your patients,
Okay.
because endo itself is technically very challenging. They don't want you to also have the awkwardness that comes from not having any patient interaction. So they don't want you to have too many learning curves at once, right?
Okay. Okay.
So it's one of the main reasons why having just a year goes a long way. And
Okay.
also that 1 year kind of just makes you ready in terms of being a little more of a professional, right? Just 1 2 years out of dental school. Um, I mean, if you see 2,000 patients a year, right? That's a lot of patient interactions, not including all of the hygiene checks that you're doing.
Right.
So you're having a lot of face to face.
Okay.
You'd be surprised how polished you are after a year or two in terms of
Okay.
how you present yourself and how you talk to patients, and how to kind of put the bigger pieces of the puzzle together. So that is why they recommend the 1 year, 2 years. As a matter of fact, right now, just in terms of my my co-residents, who were 6 years out, 5 years out, 4 years out. Uh, my co-residents that came in after us, two of them were 10 years out, right?
Mhm.
So they value experience.
And I
Right.
would imagine it makes it seem like you're more invested in the residency if we graduated dental school with 3 or 4 root canals, where
Yes.
if you're out working for a while, you've done a lot more. You're pretty much committed at that point if you want to go back to residency to knowing what endo is, root canals
Yes.
are, and doing that day in, day out,
Yes.
versus the limited experience you have as a dental student.
Yes, and which is absolutely on point. Like as soon as we leave dental school, let's be honest, we are we're safe, right? We're not competent. We're just safe. We can't, right? Yeah, we kind of know.
That's a better way of saying it than I've been saying it.
Yeah.
Walter calls people idiots.
Yeah,
Yeah.
we're idiots until proven intelligent.
Right,
You
right.
know.
Pretty much. Right. So you come out of dental school and you know where the danger lies. Hey, okay, be careful of this, be careful of that, be careful of that, and then you just try to uh, through experience, clinical, CE, what have you, mentorship, you just kind of become more acclimated towards the clinical procedures, and you get better and better. It's a practice, right? The practice of dentistry.
Right.
So having some reps outside of dental school prepares you somewhat, but also it it allows you to be more polished. Like right now, so I came back after 6 years of private practice experience, right?
Mhm.
Um, but every now and then I'm doing consults in the undergraduate clinic, and I hear how dental students are talking to patients, and then you see yourself, you're like, wow, that used to be me. You can kind of see the growth, right? In terms of just whether it be confidence, being able to communicate effectively, not using whether it be the wrong terms or the right terms, or using jargon or non-jargon when needed, not being timid. So there's a lot of elements of professionalism that like that first year that you gain, right? So that whether it be in GPRs or private practice, 1 year out of dental school, you are miles away than you were 12 months prior to that.
Okay.
So I think
Yeah.
that from a lot of the directors, that's what they enjoy. Whether you know how to do an endo or not, even if I'll be honest, like all the work that I did as a GP, right? I kind of cringe at it now. You know what I mean?
That's
Yeah,
the
you're like,
truth.
oh,
No, no, I love the
yeah,
honesty. That's the truth.
yeah,
That's the
yeah,
truth.
yeah. Well,
That's the truth.
because you don't know what you don't know, right?
Right.
And you're very confident in what you do know, and you practice. And as long as nothing becomes a catastrophic event, you feel pretty good about yourself,
Right.
right? So, but once you come back to a specialty, and it doesn't matter what specialty it is, and you understand the knowledge base behind it, and how things are seen, thought of, and done at a specialist level, you're like, oh, I I really hope geographical success is a true thing. You know what I mean? Uh,
You
uh,
know, and I bet you can even agree with this. It's more of the more knowledge, the more experience equals you being able to actually critique your previous work and go,
yes.
wow, I could have done way better. So it doesn't
Oh, yeah.
necessarily, to me, it doesn't necessarily have to be you as a specialist, but you with
Yeah.
experience and education. You know, and
Yes.
I say that to everybody. I'm like, I don't care if you're a specialist or not. It's all that experience and education that allows you to really sit down critically and analyze your work and go, whew. Because I've actually done that. Like you said,
Yeah.
right? You go back when I was working a year, and I go back and I think, man, why the heck did I do a lot of stuff that I did? No, it's the truth. Like you just sit there and start to like, oh Jesus Christ, I wish I could go back and just
Yep.
apologize to some patients
Yep.
because
Yep. Yep.
you know
Yep.
it's not the best work you could do. And heck, maybe 3 years ago, I'm looking back and going, I wish I could still apologize to somebody.
Yes.
And I
Yes.
see those patients and I'm like, oh man, that could have been so much better. You know what
Yes.
I mean? So
Absolutely.
being critical of your work, especially as you grow, is I think the most important thing. You know, um,
Absolutely.
let me ask you. So, tell us for 6 years you were working as a general dentist. Tell us the different. Were you in the same practice? Were you in different practices? And what swayed you to finally say, "Yep, I'm going to endo"? Because that's six
So
years.
yes. So all right. So how it became 6 years is all right. So a year or two later, I start dating my wife.
Mhm.
Then I got married. It's all right. Well, I can't. I got to save some money for a wedding. Okay, then, all right. No, you get married, and then all right. Then she gets pregnant. I got to save some money for a kid. And now, not but before you know, you're like 5 years into it. Like, man, listen, time flies pretty quick. You know, and that 1 2 years became five, and then you're at a crossroads where
Right.
you're married, you have a wife, you have a child, and you
Mhm.
got to make some long-term decisions, right?
Right.
So
Right.
once you're like 5 6 years out, you can't just be an associate forever. So either you take the plunge if you are um, inclined to buy a practice,
Mhm.
or join a group and buy some equity, having some type of a long-term stake,
Right.
or else you're just going to be floating around. or you got to figure something out, right? Because at that point, you're buying a house, you're getting a mortgage, you're buying, like, something is going to happen that becomes definitive. And I was at that point where I always wanted to go back to Endo, but I like being a general dentist. Like, unlike you, I didn't mind dentures. I actually enjoyed dentures. It's just certain denture patients that I find challenging. But the actual procedure, I like taking the impressions. I like,
Right.
yeah, you give them a whole set of teeth and they're smiling, and it's a lot of times they're very, very grateful.
Right.
It's just when you have Mrs. Smith that comes back for a 17th adjustment is when you're
Woo!
pulling your hair and you tell Mrs. Smith, I'm telling you, look, you hear me? How about now? Is that better? Yeah, it's better. She comes back next week and the same old thing. So,
You see, sure,
but
I had an afro before Mrs. Smith. You know,
uh,
you know what I mean? I had a pro before Mrs. Smith. You know?
I'm telling you, and nine times out of 10, Mrs. Smith just wants to just talk.
That's
Like,
it.
she wants to come in, and this is part. It's a good excuse to get out of the house, and she likes you. You know what I mean? And she might see your hairline receding, and she goes, you know what? It's not because of me. You know what I mean?
Yeah,
He's just
no,
getting old, right?
it was you. It was you, Mrs. Smith.
You know what I mean? But
Right.
I enjoyed, and I still do. I enjoy dentistry, right? But I enjoy endo more, right? And
Okay.
I've always liked it more, and I found that I was getting frustrated doing endo as a GP when you had a busy schedule. And you got at least two hygiene columns, and every so often they tap it on your shoulder for a hygiene check-in. You got another chair crown prep going on, and you're stuck in an endo, and you're having a hard time negotiating canal. You're like, I don't want to be interrupted. I don't want to be bothered. So I said, listen, this is what you like. This is what you want to do. You're at a point in your life where you got to make a real decision. It wasn't like, hey man, I hate dentistry. I can't. I don't want. Some people, let's be honest. Some people, they don't like being a general dentist. They don't
Right.
enjoy uh, having to master so many different clinical procedures, like the whole jack of all trade stuff.
Right.
And like for them, going to work, it's a little more tedious or more hassle. I loved it, right?
We
Like,
called him orthodontists.
yeah.
Right.
You know what I mean? So that was never my motivation.
Right.
It's just I I remember calling you, like, and this was a non-panic call. This was a non-clinical call. Hey,
Right.
what do I do about this case? I said, listen, well, man, I'm about 4 or 5 years out, and I'm thinking about going back to endo, but I don't know if I should do it. I'm kind of invested. I got all this going on in my life. I'm married, got a kid. I can buy this practice, and this kind of helped me just sort through my thoughts. And being the gracious big brother you are, you spent a lot of hours. We were talking about it, but there was one phrase that really, really just kind of hit it home. And it's like, listen, bro. Ultimately, you don't want to live a life of regret. You know what I mean? So if there's something that you want to do, and you really want to do it, just at least try it. Go for it, right? Because there's no guarantee that you're gonna get in just because you want to specialize. You know what I mean? So try. If you get in, at that point you have an option, and if you walk away from it, it's not gonna be like a regret. It's like, all right, it's not like it would have been a regret if I just nah, I'm not gonna do it. And in the back of my mind, should I've done it? And should I've taken a step forward? So I did not want to live a life of regret. You know what I mean? And that is what resonated the most. I already had the inclination. I already kind of did some groundwork when I was in dental school, and it just so happened that most of our faculty were still there. So when I reached out, Dr. Ray, shout outs Dr. Ray, that's a man's man. That is a phenomenal director. I mean, this guy, love him to death. It's just one of the greatest people I know. He's my kind of guy. You know what I mean? So I was fortunate that he was still there.
Yeah.
Dr. Charlotte was still there.
Yes.
Just a lot of our clinical faculty, they were still there. So when I came back and I said, hey, listen, I'm thinking about, I'm not thinking, I would like to become a resident. Like, great, man. That's good, man. How you been? Put that aside. How you been? Well, what you been up to the last 5, 6 years? You know what? I got married. Oh, let's see. So now, like, it became, hey, how you been, man? What's going
Mhm.
on? Of course, we remember you. You know what I mean? Which is for the listeners that are in dental school. Don't don't pass up on the opportunity of taking advantage of your home court, right?
Mhm.
So
Yeah.
while you're in dental school, it's kind of naive to say I want to be X, Y, and Z because it's you haven't had any experience. But if you think you may like to do something while you're in dental school, take the time to get to know the people in the department. So if you're thinking, hey man, I love working with kids, I want to be a pediatric dentist,
Mhm.
and by the time you get to second year, third year, spend some time in pedo. Remember, spend a lot of time in pedo.
Mhm.
Talk with, and the thing is, it's all about being humble. Say, hey, go to director. Don't be shy. I think a lot of people are we are so intimidated by the various residency directors, right? And we forget they are there to teach. Like they are happy to teach.
Right.
As a matter of fact, any teacher is very excited to teach a student that's willing to learn,
Mhm.
right? People hate teaching people that don't want to learn, right? So when you see somebody in clinic and I just want to get the check mark. I just want to get this signed up. I just want to get the grade. Nobody wants to teach you. No one wants to help you, right?
Right. Right.
But
Right.
but if you're motivated to learn and like, of course, it doesn't matter what field. Like your excitement to learn from somebody in a position of knowledge, that relationship is always going to be fruitful, right? So you want to be a pediatric dentist. By the time you get the second year, you think you want to be a PA, right? You're not sure because you haven't done anything. Spend some time in pedo. Say, hey, Doctor So and So, I'm in my second year, going my third year. That's kind of where the transition starts. Third year, fourth year. Thinking about doing this, and be humble. Hey, I don't have any experience, but I think there's something that I would thrive in, that I would enjoy, right? Any advice? Any advice for somebody in my position, a second year or third year student that wants to become a periodontist, a pedodontist, a orthodontist, whatever, right? And they'll tell you, oh, you know what, I appreciate your inquiry. You know what I mean? This is what I would do. And they might tell you, hey, spend some time on some research projects, do X, Y, and Z. But inevitably, they will always say, spend some time in the clinic,
Right.
hang around in the clinic, spend some time with the residents. And the reason why that is every residency program is very intimate. Like it's really two or three or four or maybe maximum five people a year.
Right.
And often just two or three, right?
Mhm.
So it's a very, very intimate program. And yes, grades matter and all that stuff matters, but really it's, do they like you as a person? Right? Because they're gonna spend, Cal, you remember, like Dr.
Yep.
Sullivan, you know what I'm saying? You guys both went to the VA,
Yeah.
like
Yep.
GPR. It's like three people, right?
Yeah.
Super. So you go from a class of 80 or 100 or whatever to a class of three.
Right.
Yep. Yep.
So now it's very, very intimate. So people really want to know, am I going to enjoy the next year or two or three with this individual in this very intimate setting?
Yep.
Yep.
Right?
And are they going to cause a lot of headaches?
Oh, they're going
Right.
to cause a lot of headaches.
Yeah.
Right? And a lot of directors, like, they don't know you based upon your application. But if you spent a lot of time in the program, and now they have some idea of who you are, how you would fit, what your persona is, and that, in my honest opinion, is gold. Like that's,
Yeah.
if you were to ask me, hey, I'm in dental school, what's the biggest thing I can do to specialize? Spend genuine time with the residency program,
Yeah.
right?
You know,
And go ahead.
no, I was going to say, it's actually, it's funny you bring that up because David Hay, and shout out to Dr. Hay, he
Mm,
was, when I was a first year, he was, I think, a fourth year. He took time out of his schedule. He was at Temple and I'm at
mhm,
Pitt.
mhm,
Took a week off of
mhm,
Temple, right? Because
mhm.
fourth year, you're about to be finished. Took a
Yeah,
week off, came, I think it was like holiday time, whatever, came to visit because he had family in Pittsburgh. So he
yeah,
wanted to go into Pittsburgh program,
yeah,
took a
yes,
week to shadow us. I mean, did
okay,
he do anything? Not really, but it was the
mhm,
fact that he came and
yes,
shadowed, showed a lot of like proactive behavior, right? And that's what we
yes,
want.
yes,
Like, oh man, this guy's really coming to us, showing us a lot of proactive behavior. That's what we want to
yes,
see,
yes,
And so that
indeed.
was key. And
Yes.
so you don't have to necessarily have your home court and just stay there. You could always say, hey, listen, I got family here. Let me go to
Yes.
that school and see what's going
Yes.
on there.
Exactly. So for those that aren't in dental school or those that want to go to a different program, that's the route to take. It's like same thing. There's the super cool guy, super cool dude from the Navy. Stopped by our program last year. He's a resident this year. You know what
Yeah.
I mean? And he was out like 5, 6 years. He was in the Navy. You know what I mean? Family man, all that good stuff. Stopped by the program and just kind of spent it. I think it's just one day. That's all. Just
Right.
but that one day, you're like, yo, this is a cool dude. This is a cool, solid guy. You know what I mean? And it's just people just want to kind of see who you are. Because ultimately, I mean, anybody in dental school for the most part, right? Everybody's super academically talented. You know what I mean? Everybody's is smart, you know what I mean, quote unquote. Everybody's just
Right.
so it's like, all right, well, are we gonna fit? Right? Are you gonna be a good fit? You know what I mean?
Can,
And
can
and
I
you may not be
interrupt
a
you
good
for
fit.
a minute, Sherwa?
Yes, sir. Of
So,
course, buddy.
so you mentioned you got married, you had a kid. So it's not
Yes.
you decided you wanted to do this, but it's not. You're not just affecting your life anymore because you have
Yes.
a wife and a kid. How did that
Yes.
conversation go with your wife? Because going from being married to a private practice dentist to
Yes.
being married to a resident,
Yes. Yes.
that's a
Yes.
that's a
Yes.
big change in lifestyle.
Yes.
You become broke again.
Yes.
You can say that. You become broke
Yes.
again.
And what a phenomenal question. Like that is so that's a real life question. All right, I have this inclination. I've been out X amount of years, right? It's different than when if you're a solo guy, single girl, whatever, you know what I mean? I can tell you for a fact, if you are a family man, family woman, this will not work without the support and approval of your spouse.
Right.
Point blank. Like, so I'm not here to paint a rosy picture of the process.
Mm,
Um, this is definitely a sacrifice and probably more so on them than you
right.
because you are the one that's pursuing your quote unquote dream or your ambition and they have to really put their lives on hold and make some serious adjustments. Now, if you were to ask me, okay, what was the biggest? So to answer your question, absolutely, you can't do this without the support of your spouse. And thank God, I'm married to my better half. She's super super supportive, and we had the conversation. I listen. It's something I want to do, and I explain it to her. And she's not a dentist, by the way. I was like, this is something I always wanted to do. And she was, listen, if you want to do it, go for it. I mean, whatever we got to do, it's just a couple of years. We'll tighten our belts and we'll just make it work. You know what I mean? It is very, very challenging to go from being a private practice full-time clinician, earning an income, a income which you can support yourself and your family with, to being broke. Like that transition slapped me in my face. And I said, like, I spoke with Walter. I said, how much money do I need to save up? And then you calculated it, and what are your monthly expenses gonna be? And it's gonna be X amount. Okay, well then times that by 12 or 24, whatever, and have that. It didn't matter. I had money saved up, man. I blew through it. Like I'm talking about, like when you don't have income coming in, you'd be surprised how quickly you spend it. And also your spending habits, they don't just change overnight. Like so, like it was the most difficult part of this whole process was getting acclimated to my new financial reality
Right.
and doing that in conjunction with a wife, a son, and a daughter on the way. Right. So, but after like July 1st, the program, November 1st, I had my daughter. You know what I mean? So like all this, like a lot was going on, a lot, and life is expensive, man. You know what I mean? And FAFSA still
Kids are
giving you
expensive.
21K.
Kids
They
are
still
expensive.
don't. Yeah, 21K, man. FAFSA ain't changing nothing.
Nope.
So yeah, like, I'm like, I got a wife and kids. Like, yeah, we'll give you an additional 2K per child. All right, per month. not for the whole year.
Yeah.
I said, all right, well, let me carry that one divided by, you know what I mean? So,
Right.
it's that was such a great question, Cal. That is like academics. Everybody is an is didactically capable of any specialty. The clinical stuff, you'll pick it up by repetition. And so that's not it's not easy, but that's not the hard part. It's that stuff that we've done before and you can do again. The challenge was going from making X amount to literally making zero,
Yeah.
and all that entails. And like I said, it took me about 6 months to really like change my spending habits. And this is like by force, mind you, because you're coming in confident, right? You got some nice little savings, you get your little student loan, and then yeah, goodness gracious. Like right now, people talk about Jeff Bezos. I hate Amazon. I hate Amazon with a passion. That son of a gun is taking all of our money. You know what I mean?
Listen. Despite
Oh
residency
man.
or
Uh,
working in private practice or working in
uh,
general, no matter
yeah.
how much money you have, listen. If you have a significant other, you hate Amazon.
Oh
I,
man. Oh man.
I see more Amazon packages than I see my kids. Like
Woo!
like there's every day there's an Amazon package. Every
Yeah,
day there's
yeah,
and every
yeah.
time the response is, well, we need that. Well, we need that.
Oh,
I'm like,
and
Bezos, I'm glad that I took you to space. Because right now
well,
that's all I got that came
I'm
out of
telling you,
Amazon
man.
was I took
Oh
you to
man,
space,
oh man,
man.
oh man. And by the way, Amazon, this is not slander. I still
No
use your
way.
service. You know what I
Oh
mean?
yeah.
I'm just saying, goodness great, it is easy to spend money on Amazon without knowing it. And while you're working and making an income, it's all good. But man, that I'm so, like stuff like that. Like you got to change. You go into Chipotle for lunch. You better get water.
Yeah.
All right?
Don't add
You
that
better get
guac.
water.
Right.
Don't maybe on a Friday. You know what I mean? Friday, you treat yourself to some guac and some chips. It was like so many. I just like we had two cars. I had to get rid of one. It's just I mean, it's just spending and then
Yeah.
getting your wife on board or your husband on board
Yes.
and you're seeing eye to eye, which is why like I mean they're making a big sacrifice because for them it's like I mean this is hey man I didn't marry you when you were broke. I didn't marry you for your money, but I didn't marry you when you were broke. You know what I
Right.
mean? So,
Right.
it's not that I'm saying that I married you for money, but this is a big change
Right.
of my lifestyle, right? Like
Yes.
so, like and which and like I
Well,
said,
I mean, and you want to, and I understand this. You want the best for your kids. Most of the time, we
yes,
work for our kids or family
yes,
members or whatever. You know what I mean?
yes,
Like you want to make
yes,
sure that you're doing what you possibly can. So you sacrificed pretty much all
yes,
your 20s, right?
yes,
So that your
yes,
30s you don't have to sacrifice. And then when you go to
yes.
residency, you're like, man, I'm still sacrificing.
You still sacrifice
When
it.
is this gonna end?
Yeah, yeah, yeah,
And
yeah,
then if you open
yeah,
a
yeah.
practice, that's even worse. You're like going into
Even
your
worse.
40s sacrificing.
I'm telling you, man. That's why a lot of these dogs when they're 60-year old, by the time they get late 50s, they get their mojo.
Yes.
Now they're living their best. I'm like, I get it. You know what I mean? But back to what Cal was saying is that there's a lot of like that can cause tension. You know what
Yeah.
I mean? And it's if you guys aren't on board together, right? Like it's you're busy enough with the program as is, but if your spouse is supportive, this becomes a very um, joyful process, right? But I could see so many ways how this could become an an unnecessary burden on you and on your family if you guys aren't on the same page, you know. So
Yeah.
it's really if you're single, this doesn't apply to you and it doesn't matter. But if you're married, like really sit down and talk with your husband, talk with your wife. So listen, man, this is what's going on, and these are the sacrifices we got. Because before and listen, I'm for the next 2 years or 3 years, I'm not going to be able to support um, you financially or our children. Or so it's and this is the income that we have, and this is our budget, and we have to work within it, so that by the time we're done this program, we're able to sustain just our necessities. You know what I mean? And like I said, man, it's really shout out to my wife. It's really it's a team effort. it's
Right.
really a team effort. You know what I
Right.
mean?
Let me ask you a question. So you go through residency, right?
Hmm.
And you can even break down residency if you want to do that. But I want to, so when I was a perio resident, I remember, the director and our faculty would take us out to like dinners and stuff, and I'm like, man,
Hmm.
they're living a good life. Like I
Yeah,
can't wait. I
yeah,
can't. This is what perio looks like. I can't wait.
yeah,
And then you get out and you're like, what happened to those dinners and stuff? Like you start to really see how the world has changed, how
yes,
dentistry has changed, right?
yes,
Because
yes,
for me, I thought I was going to go into private practice, work with somebody, who had their own practice and maybe buy them out and then transition that way. But I
yeah,
decided to end up going a different route because I
yeah.
felt like in Texas, those were the only routes that were available.
I
So
got you.
talk to us and let us know what you know about endo and how successful are endodontists, especially now that a lot of general dentists really focus on implant dentistry.
Mm-hmm.
I know I asked a few
Excellent.
questions there, but
No, and it's an excellent question. So I'll address the first part in terms of what my expectations were going in and what my expectations became going out. Right.
mhm,
Um, for me, they were pretty much the same because I spent a lot of time talking with people in the field. Right. And specifically with an endo, I spoke with Gary Dennis a lot.
mhm,
Kind of got his perspective. And spoke with some other docs, and dentistry is dentistry. So whatever stress that you had as a general dentist, you have the same as an endodontist, as a periodontist, as a pedodontist. You're still dealing with people, right? And you're dealing with them and all the anxieties and all the fears, and nothing changes from that perspective, right? Whether you do one procedure versus the other, that'll change, but your day to day is the same, right? It's just you're doing things um, more in a narrowed space, right? So instead of doing 20 procedures, you might be doing five, six,
mhm.
right? Um, in terms of the the way endo is being practiced in the light of implants, um, and people like I remember talking with some removable faculty in dental school, and they were saying, "Oh, removable dentures are gone, and you're never ever gonna do them." It doesn't change, right? 30 years later, people are still doing removable, right? Implants are a fantastic treatment option, uh, and there is an absolute need for it. And there's times where that's all you can do, but there's times where it's not necessary as a first line treatment, right? As your first modality, right? And a lot of times that's where endo comes into play, right? It's the realm of saving teeth. But some teeth can't be saved. So if they can't be saved, what are your options? Implant and prosthesis or fixed unit bridge or removable, right? So for me, it's never been about one versus the other. It just depends on what is your situation. Like, I'll give you an example. I mean, I was dentist for 6 years. A patient walks in, got a big old blown decay, carries close to the alveolar crest, right? The whole tooth is broken down. So before implants, you'd say, "Oh, let's get some prolongation done, and let's do some endo, and let's do a core buildup, and let's do a crown." All right, well, you do all that stuff, and how long is that particular tooth going to last? Right? If you don't feel confident, that's going to last a long time, and you having the patient spend all that time, effort, and money, is that the best treatment option? No. So if the restorative prognosis is poor, then don't do an endo. If the restorative prognosis is good, do an endo. Don't pull teeth that don't need to be pulled, and don't root canal teeth that need to be pulled. Right. So, like, to me, they complement each other, and I think a good dentist knows when which treatment plan is appropriate.
Right.
Right.
So the advantage endo has right now is it's covered by insurance,
Hmm.
and people live and die by their insurance, right?
I hear
We all know this, working as a general dentist or
you. Yeah.
whoever.
Yeah.
The first thing they ask is, does my insurance cover this? Tell me if I'm
Yeah.
wrong. right? That's the first thing they say. Does my
Yeah.
insurance cover it?
Yeah.
So right now, the advantage Endo has over implants is it's covered by insurance. So now, fast forward, if implants are covered by insurance, what do you guys think will be the likelihood that somebody will say, keep that tooth or take it out and place an implant?
It depends on the dentist, right? So if I'm all right, so let me put on my general dentist hat. You come into my office and let's say it's a single tooth, right? And I'm debating, should this be an implant case or should it be an endo crown case, right? My mantra is very simple: is this tooth restorable, right? And is it in function? Because there's times a simple extraction might do. If you're missing tooth number 15, right, and we're talking about your opposing tooth, right, tooth number 18, right, and that tooth has a big old blown decay and it's able to be restored. If you're not going to do anything about the missing 15, do you need to restore 18? Right? So you have to, let's be honest, right? Spend $4,000 for what? If you don't have the opposing dentition, so it's treatment planning. All right, so let's say this tooth is in function and it's restorable. If it's in function, it's restorable, why would you extract it? See? That's I mean, you have to know how to treatment plan. You have to know how to. That's why I said being an endodontist, you're still a dentist. Like this is still dentistry.
Well,
It's
but
still fundamental dentistry,
right, but
right?
endo is not sexy, right? It's great, and
Yes.
no, honestly, as a periodontist, I send a lot to my to Gary, because I work with Gary, to endo, and I'm like, hey, you might want to keep this tooth, right?
Yeah.
But it's not sexy, right? We go on these little we go on these little track where sleep apnea may be the big sexy thing for this
Yeah.
year, and then it might be implants, and it might be
Yeah.
this. And remember, at one time it was everybody gets a veneer.
Yeah. Yeah.
It's endo is not sexy. So most people follow what's sexy because they're like, oh, this is what's going to make me the fastest amount of money, and this and this and that. So how do you go about combating that? And Kyle, please, like you're in the thick of things. You are a general dentist who have your own practice. You know both sides. Like, what are you seeing? What are you hearing when it comes to implants and endo?
So we all went through the VA.
Right.
Sherwa rotated through there. I assume
Right.
they still
Right.
do that. Um,
Yes.
So Dr. Sullivan was somebody that really taught that whole look at the whole picture when you treatment plan. If it's a 25-year-old person with that needs a root canal, one number 19, you have to think what's going to last the longest, because nothing is 100%. You can put an implant in it, there's a real high success rate with it, but it might not be in there for their lifetime. In fact, we shouldn't be telling people it's going to be in there for your lifetime. So if I do a root canal and crown on a 25-year-old, that should buy me at least 15 years. In 15 years, if something breaks, if something fails, then I always have the option to take that tooth out and put an implant in. If I go straight to, let's take this tooth out, we'll get an implant because it's the sexy thing to do, or, I'm going to make more money doing it that way. What happens in 15 years or 20 years? This person's now, 40 years old, and they might have bone loss around an implant. They might not have another option at that point versus a bigger, more invasive surgery. So that's where that bigger treatment plan overview comes into play. And I honestly think endo is sexy. That's one of my favorite procedures because my favorite patient walking in the door and my easiest patient to say yes to treatment is somebody that says, I have a broken tooth, I have a toothache, can you fix this? I said, yeah, you need a root canal and crown. Great, let's do it right now. And because they want to get out of pain. It's some of my hardest people to say yes to are, you've been missing this tooth for, a couple of years. Your teeth are starting to collapse into the area. You're starting to lose bone. You might want to consider an implant to prevent all this from happening. Well, nothing's hurting. Nothing's bothering me. That's, $2,500 or more. Why would I want to do that? So I think endo is sexy because I can give you an immediate result and get you out of pain.
Okay.
Mhm. And to add to what Cal was saying, and I think that's the concept that needs to be hammered home is try to try to extend your toolkits, right? Extend your options for your patient's lifespan,
Okay.
right? So I can even bring this back to just the non-sexy endo, and I'm with Cal. I think endo's pretty sexy. You seen the curves?
You're buying. You're buying.
Have you
You're
seen
buying
the curves on those molars, man? Goodness gracious, man. I don't know. I like curves. I don't know about you out there. I
My
like
man.
curves.
I don't even think we're talking about endo anymore, but that's all
Uh,
good.
but even there's like, I don't know if you guys are familiar. Have you guys been familiar with vital pulp therapy?
Yes.
Okay, so that is the hot topic right now in endo, right? And it's being able to treat teeth that we would traditionally treat with root canal, full blown out pulpectomies, root canal therapies, with a pulpotomy and some type of a bioceramic, right? And the whole concept is alluding to what Cal was talking about, extending the treatment span, the lifespan of that tooth, right?
And is it only
So
limited
that
to kids? That's something that
no,
okay.
no. So
Right.
that is the hottest, and the AE just released a new guideline on this. This is where a lot of the research today is being done. One of the areas it's that you can have a patient, an adult, walk in with a toothache, irreversible pulpitis, big old decay into the pulp, right? And as long as the tooth is vital, you get in there, remove the caries, and then you amputate the pulp. So pretty much you remove all the pulp, all the pulp tissue in the chamber, right? And then use some type of cotton pellet, maybe dipped in sodium hypochlorite, get some hemostasis, right? As long as you're able to get hemostasis within a few minutes, that tooth right there, you can just put some type of bioceramic, right? Whether it be an MTA or any type of calcium silicate product in there, and then restore it. So now you have a tooth that we would previously restore with a full-blown root canal therapy that we have now done a pulpotomy on, an adult tooth, vital pulp therapy. And you can restore that tooth. And then down the line, let's say 5, 10 years, a problem happens. Well, now you can do a root canal on this tooth, right? So you've extended it. And then another 20 years, the tooth gets fractured. Now you can do an implant,
So
right? So it's,
you kept the tooth vital
yeah, you
for
kept it
longer.
vital.
Got you. Okay.
Yes, and you're employing, you're extending the treatment options for that tooth throughout the patient's life cycle,
Awesome.
right? So
Awesome.
this patient, Cal was saying, was 25 years old. Well, if we did an implant on them when they're 25, chances are how likely that implant to be there when they're 50, right?
Right.
And you know better than anybody else that the literature on peri-implantitis and so on and so forth. But it's the whole idea is what can we do, because we have a patient population that's living longer, right, retaining their teeth more, and we need to have tools in place so we can address our patients from when they're young to when they're old, right?
Right.
So a lot of it is treatment plan, right? But
Okay.
if you were to ask me, if I go put my general dentist hat on, if I get a patient in my chair, if the tooth is in function and it's restorable, endo crown. If it's in function and it's a poor restorative prognosis, get the bad boy out of there. And now talk about implant crown, bridge, or nothing, or removal. But talk about, there's no need to be a hero anymore, right? Because you have the implants there as a viable, solid treatment option, right? So if you got decay all the way down to the bone, perfect example, tooth number 9, big old decay into the bone. Why would you want to do a crown ligation tooth number 9 and affect the ability to maintain the gingival contour if they need an implant in the future?
Right.
Right. So I mean, why? So like you have to, and that's what I'm saying. To be a good general dentist is very hard.
Yeah.
Like it's very hard to be a good general dentist. Like it takes a lot of investment, right? You got to spend a lot of time reading. I'm talking about C courses. Like you got to be invested, right? And if you're not, then all right, you're gonna say you're just gonna look at the dollar amount or what you think is the best based upon what your reps are telling you. And which I always find, how are you taking advice from a rep? And I'm not here to
Oh
dog
boy.
the rep, but how are you taking a clinical advice?
You're about to get into a whole other
All right,
issue
yeah,
that I have. But we
wait,
won't do that. We won't do that. We'll
all right,
come
all right,
back.
all right, all
Yeah,
right.
we'll
Leave it
come
alone.
back to another
All
episode
right,
that
all
says,
right. I got
why
you.
would
I
you
got
take
you.
advice from a rep? That'll be
Why
another
would you take
episode.
clinical advice from a
Yes.
non-clinician?
And
Is
that's
what I'm saying.
but
Yeah,
that's the
right.
first thing a lot of people call. They call their rep and say, I
Yeah,
have a problem. You know?
and and the reps are great. Like
Yeah.
I'm not
Oh,
here because we
absolutely.
all work with them. We all need their help.
But they're
They
I
know
mean,
their products well. But
yes.
why would you take clinical advice
Yes.
from a non-clinician, right? Who's not
Yeah.
even a doctor, who's not even like,
Right.
and it
And
just comes back
and
to,
you know the funny thing, I've talked to reps and they're
uh,
uncomfortable in that situation. They're
I
like,
believe
I
it.
should not be telling you
Of
clinically how to do this. That should not. I've
100%.
literally talked to multiple reps that are like, I don't know
Yeah,
why they keep calling us. I
yeah,
mean, I
yeah,
know my product and I can help you and get you the right
yes,
tools and instruments,
yes,
but I should not be
yes.
telling you what to do clinically. You know, but
Absolutely. And shout out to the
dentists,
reps. They're
yeah, shout out
phenomenal.
to like, dentists.
Yeah.
You put reps in a very uncomfortable situation.
Let's not just dentists in
Yeah.
the operating room at some of the
Oh
hospitals
yes,
that we.
MDs. Yeah,
It's MDs too with the
yep.
joint replacement
Okay.
reps, and it's all
Okay.
Yep.
reps, all medicine.
No, they scrub up. They
Wow.
definitely scrub
Wow.
up. I know that. But okay,
Wow. Wow.
let's
Yeah.
wrap this up, right? Give
All
me
right.
one advice you would give somebody who was in your situation as a general dentist, thinking
Yeah.
about specializing. Give me like a summary of one great advice you would give them. You know, you're the big bro now. What is the best advice you can give them that transitioning into possibly going to specialty?
If you are inclined, right, to specialize, just do it. Come what may. Try it. If you're inclined. If you're talking about, hey, I don't like general dentistry, I think I might like being a specialist better. I'm not going to tell you what to do, but that motivation might not be the best because I think you're going to have the same problems that you have with general dentistry as a
Yes.
specialist. But
Yes.
if you're saying, hey man, I really like this part of dentistry, and I'm thinking about specializing, and I'm in dental school or I'm outside of dental school, if you have that inclination, just go for it, man. There's no point living a life of regret. You know what I mean? And not saying that you're not going to be happy as a dental dentist, but you may be the best dental dentist with a regret. And life is not worth having regrets. Right? Like if one thing I know, just it's not like a Nike commercial, but just go for it. And just do it. Don't think too much about it. If you have a spouse, see if they're on board. If they're on board, and a lot of times, if they love you, they are on board. The sacrifice, it's a short term sacrifice, and hopefully, your joy and your excitement means a lot to your significant other. That they will be there for you, and while they're there for you, remember that you got to be for them as well. So don't expect them to flip the switch as quickly as you do. You know what I mean? They have to transition as well. And ultimately, if you are inclined, it's worth it. Might just make sure you're not doing it because you don't like your current day to day. You know, like all people say, oh, I don't oh, I hate corporate dentistry. Well, then don't do corporate dentistry, right? Oh, I hate ownership. Why? Then don't own. Like, I just finished my program now, and I'm gonna go in private practice, and I'm gonna have this. I'm dealing with patients, the good ones, the bad ones. I'm managing expectations. I'm dealing with insurances. And I have to manage come what may in the clinical chair, just as I used to as a general dentist. So it's if you're inclined, just go for it.
Well said.
Sure. we would love to have you back on because I got a lot of other questions for you. But I'm not going to say Walter and I are cheap. I'm going to say we're frugal and we're limited to an hour.
Okay.
We just got our notification that we're close to our hour, but
Right.
because we don't want to pay for anything.
I
But
got you. I got you. I got you.
I would love to have, or we would both love to have you back on and
Right.
ask you some more questions.
Right.
It'd be an honor.
And honestly, I think this is like a two-part kind of episode because then we can dive into what Endo looks like going forward, right? Because
Sure.
Endo is changing just like any specialty is changing, right?
Oh, yeah.
And what's the hot topics? And if somebody is a general dentist that loves Endo but doesn't want to go to residency, what are some of the things that they could do to better their skill level? Right, those are all things that we could talk about.
Absolutely,
we can talk about
absolutely.
implants and how endodontists are placing implants. Right, that's another thing that is happening.
Absolutely.
And if that's what you were trained or what, I don't know. Right, but those are the kind of questions that I want to talk about later. So
and that's a very good question. It's a good topic.
Right, so we'll transition that, and this is a teaser. I like to do that nowadays. I'm getting better at this podcast stuff, right? But we will definitely talk to you very soon. Well said as always. Again, sure was. We've both known you very well for a very long time, so we definitely appreciate you coming on. Go enjoy your weekend. Go enjoy your time, and you gotta come back, man. You gotta come back.
I will. Cal, Bedford's finest. Good to see you, brother. And Walt, thank you for everything. And
my man,
I'll be an honor to be back.
We'll talk. All right, enjoy, John.
All right. Yeah, take care.